Here's now how to palpate the multifidi. It's very tricky to do to yourself. I'll show you how to do it, but it's much easier to palpate this on someone else. So if you have someone available, you can try this out. So the first thing you're going to do is both hands behind your back, and I'm palpating the spinous processes of the lumbar vertebrae. I'm trying to get down to about L4, L5, and then down to the sacrum. So once I'm on the spinous processes, I'm going to go outward, and now I'm sort of in between that little gutter between the spinous processes of L4, 5, and S1, and then where the PSIS are. And you could sort of go up and down a little bit. You've got a little bit of leeway here. But there's the main thing we're concerned with is this big patch of multifidi that we talked about that really lives right just medial to both PSISs. So you can get some more superficial fibers up higher here, but as I go down for this particular exercise, we're going to focus right here in between the PSISs. So the cue here, these are a little tricky for the patient to understand, is draw your PSIS together. Now, that sometimes doesn't mean anything to a patient. To you guys, you know what a PSIS is, so it might make a little more sense. But you can practice that cue. What you're basically doing is visualizing those two bones drawing together. You can maybe give a cue to your patient, if you have one, of this sort of thing, where I'm kind of bringing my thumbs towards the midline. But the idea now is that I'm going to feel, just by sort of thinking about that, maybe I feel a little bit of a muscle contraction. I can get it a little bit. Some of you might be able to. What I find more effective with people, who, especially when they have no idea what the PSIS means, you can do a very, very subtle extension of the lower segments of the lumbar spine. So what do I mean by that? Not that. It's not this big, gross extension. It's this very, very subtle extension. You may or may not even be able to see it in the video. But imagine the cue that I often give my patients is that I'm trying to peel my pelvis, my tailbone, from the tailbone up off the table, just barely. So again, you want to avoid a lot of very gross visible extension. It's just barely enough extension where you feel this tiny little muscle contraction here. It's not a huge, big contraction of the erector spinae. It's only on that part that I'm palpating. The other thing that you can try is hip extension. Very, very subtle. You can see it's not that. Keep my legs straight, just barely off the table, and I'm alternating back and forth. Typically what you'll feel is when your right leg is off the ground, the left multifidi fire a bit better, and when my left leg's off the ground, the right side fires a bit better. So try all three of these cues. Try them on yourself. If you have a partner, try it on them. Drawing the PSIS together, very, very tiny, subtle extension of the lowest lumbar segments, or hip extension. Again, the contralateral side will probably fire depending on what hip you're moving. Similar to the transversus abdominis, you can start out building up time of holds. Work way up for a second or two, maybe build up to a 10-second hold. And what I'll show you now, one preliminary exercise to add into this, is alternating leg motion while you're having the muscles fire. So now what we're basically going to do is just fire those muscles. And now I'm going to raise my hip. I'm going to extend a little farther than last time. So now what I'm trying to do is maintain that contraction, not hyperextend. Sometimes what you can do is have people slightly brace their abdomen while they're in that tiny bit of extension so that they don't hyperextend. It basically shuts off the erector spinae but maintains contraction of the multifidi. So it'll look something like this. I've got a little abdomen contraction, now a very subtle brace here. My erector spinae is relatively mush. And now I'm doing these leg motions a little higher than before. And the idea is that I'm using my abdominals to not bring in a ton of erector spinae work. It's very, very tricky. Practice these with just getting the multifidi to contract. Once you can do that, then you can try to add in the lower extremity motions.